Hi, I'm Bob Speelman, Vice President of Culture.
Hi, I'm Garrett Holt. I'm the Director of Therapy Operations.
I'm Mara Luzader. I'm a speech therapist.
I'm Chad Shinneberry. I'm the Director of Therapy Utilization.
I'm Brittany Diltz, Director of Therapy.
Hi, I'm Grace Rollins, Chief Strategy Officer.
So the first question, when and where did this concept of delivering therapy first start?
So for me, it started with a simple email to you, Bob. I was working out my notice for the previous contractor that we had at Country View, and I caught you outside of the facility and mentioned that I was putting in my notice, and you were disappointed to hear that, and you complimented me a little bit and said it'd be a loss, and if I ever want to do anything different, you'd be interested to talk about it. And I didn't think much of it, and then when I got home, I thought, man, I actually do want to do something different. The reasons I'm leaving, I feel like I can fix. I can do something about it. And so I sent you that email and said, yeah, I do know what I want to do. I want to try to fix some of these things in our industry and therapy and do it for foundations. And at the time, I had told Chad that I'd sent that email, and he was like, really? What did he say? I said, well, I don't know. He hasn't responded yet. So, and that kind of got our conversation going, of how could we fix it?
And you guys have known each other for a while.
Yeah, we've known each other. We worked together for a while, and then I had talked with you actually, and I had told you the direction I didn't like the industry was going with therapy, and if there was any room for progression with foundations, and you said your recommendation was to become an administrator. I have a therapy background, become an administrator, so I pursued that, went back to school, got my business degree, and was on that path, and then all this just kind of happened, and I was able to utilize that degree too, I think, a lot with this transition.
I think that's where it started, and then when you responded to that email and kind of gave me that end to where, hey, this might be something that we could actually talk about and realistically do, we kind of started to put things on paper. I know Chad had talked to Grace, who you had put me in contact with, who he was already working at a building where Grace was.
Yeah, I had left there, but I was doing human resources, and she was in the facility too, and I was managing at the time for therapy and finishing up my degree, and I kind of ran some ideas by her and told her my dissatisfaction, and it all kind of happened at the same time.
Yep. For a while it was kind of weird because I don't think you guys knew that we were even talking amongst each other.
Yeah.
And then we just kind of came clean and we're like, yeah, by the way, we're like friends, and we have really similar ideas, and we'd like to do this together, and that's kind of how it all came together.
There needed to be a change. The industry for therapy it's one of those where the expectations have become so high that, and this is just my personal experience, but they had become so high that I didn't enjoy my job anymore. I felt like I was a number, and it was routine. Wasn't happy with going to work every day, and that's why I left. And that's why something had to change, and that's why I was going to be an administrator, and it's probably why Garrett left the industry as well. It's just it had been going in a negative direction for a long time.
Brittany, you're nodding. You've been in the
sure.
industry a while, and you've been a director for a while.
Yes.
Feel the same feelings?
For sure. Yeah. It wasn't a pleasure going to work every day. It's a lot of stress, but there needed to be a change for sure.
Why was the old way of delivering therapy then just not working? Why were you guys so dissatisfied?
For me, it was, I'd go to work every day, and I'd have this expectation that I found it very hard to meet, and I didn't have the quality time to contribute to I felt like I couldn't be a part of the facility. I felt like I was isolated as a department. I had to adhere to these time restrictions and hurry up and get my stuff done, and then leave, even if that meant that it wasn't an 8-hour day, or that I didn't have my paycheck at the end of the pay period. And I couldn't fulfill that time by doing things such as helping to pass trays and contributing to the facility, because it was all about strictly skilled therapy. That was my sole job, is just skilled therapy. And every other department I watch, they're helping. Some people are folding towels, and some people are helping to pass trays. Even administrators are out on the floor passing trays. And I do those things, but it comes at a consequence.
And when you say expectations, is that what they refer to the industry as productivity standards?
Yeah.
Okay.
Absolutely.
Yeah.
Okay.
And there's other things that go along with that too. But I mean, with all the changes in reimbursement over the years, over the past decade, there's been a lot of lost reimbursement. And so the only adaptation that a lot of the therapy companies and the contractors have made is, well, let's make the therapists work a little bit harder. And to an extent, therapy can get on board with that. We get it, there's been changes, we can up our productivity a little bit more, maybe group these people or do some things a little bit differently. But once you raise that bar to a point that it becomes impossible, what are we really doing anymore? Now you can't meet the expectation. You go into work every day going, I can try, but I'm not going to meet this expectation. And when I do, they're probably going to raise the bar higher. And that's, I think, where the whole industry was.
And what type of things can you not do because of these productivity standards that you wish you could do?
Simply just answering a call.
Okay.
Like,
Is that right? Okay.
walk down the hallway, you're like, I don't have time to do this. I got to go on with my day and get my tasks done.
Another thing too is, especially foundations, you guys do a lot of employee appreciation. And we weren't able to be involved in that because we had to meet those standards and those expectations. And now we can be involved.
Even just things as simple as having a conversation with a family member or a resident. You finish up a treatment, they're, excited that they're doing better in therapy. They want to tell you about, their life and their family. And it's like, I hear about this, but I legitimately don't have the time, or I'm going to get a nasty email that, I wasn't as productive as I should have been, or, hey, what can you do better to do time management, a little bit better. And it's like, when you get to that point, it's like, come on, it's getting so far away from what we're supposed to be doing that it's not even, it's not what we signed up for.
Can I ask, so I've heard from a few directors that there was such thing as worrying about your health insurance under the old system. Can somebody explain what that means?
Yeah, so I think what they're referring to is, with the productivity model, their labor hours are not guaranteed. So if they don't have the skilled treatment for therapy to support the time in the facility, they're at risk of losing their job status. So they could potentially go from full-time to part-time to a lesser status, which would then affect their insurance because they don't have the therapy, even though they're helping out with care conferences, they're taking the time to help pass trays. That stuff doesn't count. It's all about the number.
Is that common across the board?
Pretty common.
It's every place I've been.
Yep.
And
Other than
In my
that.
experience.
Would that not cause stress on you worrying about?
Yep.
Well, it's stress.
That's why I left. Yeah, that's why I had to have a change.
So how has this concept, this new idea of delivering therapy, how has that been embraced by staff, by residents, family members?
I think when Chad and Garrett first came to talk to us therapists about this new concept, we were all really skeptical because it was new for us. Never been a part of something like that. Now that we're in it a little bit, the last several months, we know that this is real and we're seeing a change and we're no longer skeptical. It's good things are coming from it. I think one of the biggest things too with floor staff especially is they're coming to us and they're talking to us and they're asking us questions. Bob, that's how you and I met. Was you guys needed help with a transfer. And you guys came down, grabbed me in the therapy gym, and I helped you guys with the transfer. Before, that would have been much more difficult for us to do. We wouldn't have been able to go to the floor and help on the floor, pass trays, help in the kitchen. I think we're just more approachable now as, in-house employees. So I think that's a huge difference just for therapists and the floor staff.
And Mara, are you finding the same thing?
Yes, being able to jump in on a hat, being like somebody seeing you walk down the hallway and they need help and you're able to actually do it and be a part of the team and put in that same effort. And it's nice to actually know everybody's name in the building because before I probably didn't know most of the staff's name and even most of the residents' names, but now because I'm able to go around the building all day long and interact with everybody, I know everybody.
Worrying about health insurance, no longer an issue. Worrying about productivity standards or meeting these, is that all?
Such a relief.
Yeah.
Such a relief.
No longer have to worry about that. And, especially as a manager and as a full-time employee, a lot of times we were working off the clock because we were so worried about that productivity standard. We didn't want those nasty emails coming by, but now we don't have to worry about it. And if we don't have a full 8-hour day of skilled treatments, we can help on the floor. We can pass trays. I can actually sit in a 2-hour long meeting and not worry about, I gotta go. So I think that's benefiting the patients even more.
Can you give an idea or an example of a resident noticing it or a family member noticing it, or do any of those things pop out? Or fellow staff members, I'm sure, notice?
I think patients or residents specifically, they're noticing that, we're kind of spending more time with them. We're bringing them down to the gym, even though we're not doing therapy. We're just kind of hanging out with them, making sure they're doing okay. If they're having a bad day, we notice it, we talk to them. Before, we weren't able to do that, specifically care conferences. Care conferences, I used to try to get out of there in like 10 minutes, and that's all about the patient.
Right.
And now we can spend a half hour talking to the family and talking about goals and plan of care and actually spend that time that's needed.
Laura, why don't you talk about how you've helped out at Darby with some of the vacancies and where you've been able to step in? That's
At Darby Glen, we're having a little bit of some staffing changes, so I'm able to fill in those areas and where I previously would not have been able to, like especially in the kitchen. The speech therapist really works closely with the kitchen, making sure that everybody's getting the food they need and the certain diets. So being able to jump in and help out in that way has been really helpful to the facility, one, and then also just kind of nice for me to really know what's going on and why sometimes things are difficult for them, understanding that stuff for them.
Can I ask too, so you go to school, you're a fairly new grad, you've been doing it for a while. When you go to school, do they teach productivity standards or do they just teach therapy, and then when all of a sudden when you get in the real world, it's like, whoa, wait a minute, what's this all about?
Yeah, I was not taught that in school.
Okay.
When you look at skilled nursing facility compared to outpatient doesn't really have that productivity. So I think that's one of the reasons why they don't teach it, but in skilled nursing, that's been the way, is productivity. That's all we cared about, was we got to make sure we're getting these minutes to meet that productivity standard. So yeah, when you go into skilled nursing, you're kind of just jumping right in and not understanding productivity.
Yeah, I was not taught productivity, and you're just taught like this bright-eyed version of therapy, and then you're thrown into skilled nursing and kind of thrown off guard that you're not able to do things exactly the way you thought you were going to in school.
From my experience managing under some different contractors, is you would get scenarios where they would send you a new grad, fresh out of school. They'd send them to you. They'd get minimal training, and then they would be expected to meet the same standards that a veteran therapist had met, after 2-3 weeks of working. It's like, this person just graduated. They're not going to be able to hit these standards, but yet they're still expected to. And so it's stressful for those new grads coming out, and they're like, man, I feel like I'm doing terrible. Well, no, you're not. You're doing great. It's just, you got a lot of learning to do. You have a lot of, just a lot of things to learn before you're going to be able to meet those standards that are already impossible to meet anyways. But
So this new concept, in actuality now that it's being implemented, is the joy coming back for doing therapy?
100%, yeah. The therapists are happy. We can actually have a conversation and sit down and talk about our residents, the reason why we're all there. And we can really talk about, how they're thriving in therapy, and just sitting down and having that employee appreciation is huge. And we can do that now.
how many therapists have been Employee of the Month recently?
That is true.
Yeah.
I've noticed that.
Yeah.
Yep.
I mean, I just think you guys have been really shining through what you're able to
Yeah.
do, whereas under a contract model, we didn't necessarily see all that.
Right.
So-
We were kind of outsiders with the contract model, and this in-house, we're actually employees, which is huge.
Yeah.
What a change. Yeah.
and this doesn't necessarily need to be on camera or anything, but but I do I do want to say just in front of you guys, because I've known Lauren for a long time, and to reach out and say the things that she said about you and the work that you're doing at Darby, that speaks volumes about the work that you're doing, because she's not really one to just reach out for no reason. I mean, that's just not who she is. So for her to do that, it's like, wow, you must be doing a great job.
Try.
And Lauren's the administrator. at
Yeah,
Darby.
yeah.
So is there a difference in the outcomes? Are you seeing a difference in the results?
Absolutely. So one thing that I've been paying attention to with the reimbursement change a couple years ago from RUGs to PDPM, the government was concerned that therapy would stop delivering as many minutes to be efficient and to beat margins. And then that would impact, of course, how the patients did functionally. So I've been looking at therapy minute delivery versus, mobility and self-care functional outcomes, and is there a relationship there? So with in-house, we've had a couple quarters under our belts in some of our buildings, and it's very obvious our functional outcomes are better. So that's exciting. This has been a little bit of an experiment. So you don't know. You think it's going to go well, but to have that data there to support that this works has been huge.
The outcomes, the results are better, and we're doing something we all feel good about, and the therapist. What about financially? Is it costing us a lot more to deliver this model?
No.
Is that right?
Yeah, this isn't pie in the sky. This is good business sense as well. Like, you hear that, right? If we do the right things for the patients and it's going to be right for the business, and you guys can probably speak to some of the skepticism with those types of comments, but that's what we're seeing. You know, we had a certain amount we were paying our contract company, and we based that more on a percentage of revenue. That's one way to do it. Or you can do it more like a per diem rate. How we've done it in our company is just said we're going to budget labor hours. So we had a cost that we knew we were going to spend, and we were going to commit to that spend as a company. And it was less than when we were paying contract. And
That's to me that's exciting to hear.
it's really
I mean,
exciting.
yeah.
To speak to some of that skepticism, knowing that I'm not providing as much therapy as maybe I would in a contract company, it kind of at first made me wary of if I'll have a job for long term. Now that we've been doing it for I think like 6 months now, I feel very secure that my job is safe under this new model.
Can you give an example of what typical caseload would need to be, or is there such a thing?
To get 8-hour day, you need like at least 7+ hours of treatment. And
And how
Okay.
many people does that equate to typically?
So for speech therapy, that typically equates to 14 patients on caseload because you're seeing them for 30 minutes a day.
Okay.
And OT and PT, I think it's a little different because usually they see for a few more minutes. But yeah, so that would be 14 patients
A day to maintain that status, that full-time status.
And can I ask currently what you have on caseload now?
I have 3 on caseload right now.
That's a big difference. So obviously then the quality of time, the amount of time, the outcomes, I mean, that explains.
Yes, because especially when you have 14 people to see, you're really stuck to that 30-minute time limit. But now, if a patient needs more time with me, I could spend an hour. I could spend an hour and a half if I really wanted to. And that's okay. I'm able to do that. So you can really give the patients what they need in order to advance to a higher level of living, or even, especially in skilled nursing, to get back home to their prior level.
What are some of the things that you do when you're not providing skilled therapy?
I do a lot of things. Lately, I've been, like, every day I'll pass ice water to people. Prior to being a speech therapist, I was an STNA, so I really understand it's a hard job, and there's a lot of things you have to do to make sure that people are getting what they need. So even just to take a few tasks off the STNA's hands throughout the day, like, they are thanking me constantly. Or I could even help transfer them and do other things like that. So I do a lot of stuff throughout the day.
And that was our hope, honestly,
Yeah.
that if caseload decreased, there are things going on in the facilities, you know, healthcare's in a staffing crisis, it's just what it is. And so we have therapists that step up and they do it just out of the love of their hearts, really. I mean, it's amazing. What we were hoping is if caseload is down, what else is going on in the building where you can jump in, and they do it.
That's outstanding.
It came to mind when you were talking about 14 people in a day, and the way healthcare companies protect themselves from audit, inquiry, litigation is documentation. On top of that, you know, for our practitioners being able to make good decisions, you have to have documentation, right? So when you're having that type of caseload, we're not getting the documentation that we would want as a company, or as our practitioners probably would want to be relying on to make treatment decisions. So that's another thing that's improved under this model and is helping with outcomes.
So in having this discussion, I mean, I'm excited about the results and what you guys are saying. It seems to me, and I'm curious what your guys' feeling is, what you're doing with this new model completely aligns with our culture of care, with our mission statement to have the right people in the right place doing the right things for the right reasons. What's your feelings on that, and is that play itself out with the employees you're talking to?
Absolutely. You know, as foundations, we have this great mission statement and these core values, and what we're doing is just letting the therapists live those out. You know, we're giving them the time to give quality treatments and engage residents and just do the right thing, essentially. You know, do what's best for the building, what's best for the resident. and then at the same time provide them with a nice work-life balance and an enjoyable place to come in and work. And so the mission statement and the core values just take care of themselves.
Right.
You know, we're hiring good people, and then we just allow them to do good things in our model. We're not just focused on that productivity and how many people can you see in a day. It's what can we do for the people that you are seeing.
That's outstanding.
I've always been in foundations facilities for my entire career, really. Never worked for foundations as a company, always through a contract company or a sub company, but always been in their facilities. And I've stuck around through all these changes because of the culture of care. You know, foundations they stand alone in their beliefs a lot of times, and that kept me around. That attracts me, and now. What's the beauty of this is we're able to implement that. The only thing, always the therapy department was isolated. They always watched that culture of care from the outside looking in, and now we're able to implement that as part of the culture of care. So like Garrett said, I think we really try to incorporate all of the core values into our new model.
Bob, one of our core values being don't just have a problem, find the solution. And I think that's what's been transformative for therapy in our company is that you guys walked away because of a problem, but instantly, what is the solution? I mean, that's where you guys were talking and brainstorming and getting a hold of who could listen and actually put you in a position to do something about it. So you're living those core values. It's a top-down process. If leadership believes in the mission and shows the values, then everybody else can get on board. So I really want to highlight that. You guys found a solution to something we were.
Well, and just to speak on that is you guys had to give us the chance to implement that solution. That never would have happened had you guys not recognized, folks like me and Chad leaving, and there's a lot of good folks that were leaving. I think that was a topic of conversation. You took the time, to sit down with us, listen to us, and then say, well, what ideas do you have? And you liked them. So.
And I'll tell you too, this is a testament to Brian Colleran, our owner and founder, who believes in his people and wants to do the right thing. And I think when he heard this idea, he was a little skeptical too, but he wants to be bold and he wants to do the right thing. And I think now that this is being implemented, that nobody else is doing, which I, for the life of me, can't understand. And I think probably once people hear this message, everybody will want to do this. I mean, but it's exciting for me. So I got to thank you guys for taking the chance, for not settling and knowing in your heart there's a better way. To me, that's exciting, and that's what it's all about.